Okay. I am Nurse Rachel. This is my dad, Mark. Mark is a 58-year-old white male, 6'3", 210 pounds. His birth date is October 2nd of 61. He is a general Midwest manager for a national pest control distributor company. He is Christian. He learns best by seeing things hands-on and then doing it for himself. That's how he learns best. The overall presentation goal is that once I give Mark the information about aneurysms, which is our topic today, he will be able to know a little bit more about them and how to properly educate others. Hypothetical scenario is that Mark came into the clinic today for an annual checkup or physical and asked me, the nurse, a little bit more about aneurysms as a family member has just been recently diagnosed with an aneurysm. So I handed him our handy dandy trifold pamphlet about aneurysms. So after this teaching session, Mark, what are 3 things that you hope to learn about aneurysms?
Well, how to diagnose them, or how to figure out that you have one in the first place, and then how can you treat that that condition that you have.
Okay, so we're just going to start from the top about aneurysms. So an aneurysm is basically an abnormal dilation of the blood vessel. So there are 2 main components of a blood vessel, which is elastin and collagen. So collagen provides the initial strength that prevents the dilation. So if you think of like a garden hose, the garden hose is thick, and so it prevents water from, going out into little holes. And then the elastin helps the vessel recoil. So when you don't have either of those, then it's very hard for the vessel to keep its shape, and then it causes kind of a dilation like that.
Okay.
A main contributing factor of aneurysms is hypertension or high blood pressure. So if you have high blood pressure, then you really need to keep it monitored with medications and things like that, because basically with high blood pressure, the pressure of the blood going through the vessel, specifically the aorta, is the biggest vessel that the aneurysms are found. It's because that strong pressure keeps pushing against the vessel wall as it's trying to go out to the rest of the body, and then it can cause it to weaken over time. Okay. There's a couple different types of aneurysms. There's a true, a false, and a dissecting aneurysm. So the true is a long-term eroding of the vessel. So the patient has probably been hypertensive for a very long time. They have not maybe watched their blood pressure. This affects all 3 layers of the vessel wall: the endothelium, the media layer, and the adventitial layer. And then there's a couple different types of a true aneurysm. One is the fusiform, which is kind of like a tube. So it tapers off at both ends, and it kind of looks like a Tootsie Roll. So the vessel is bigger, and then it kind of tapers off with the regular vessel. So it kind of dissects like that.
Okay.
And then the circumferential is just a circle all the way around. There's no Tootsie Roll. The false aneurysm is more of a traumatic break. So for example, say that you got into a really bad car accident and your aneurysm just breaks or rips and you die immediately. That is a false aneurysm because it was from something traumatic.
Okay.
And these can usually be saccular or kind of look like little berries sticking out from the vessel. Yes. And then the last one is dissecting, which is when the vessel wall just rips and begins to hemorrhage. So it'll just start to dissect open, and you're just going to bleed, and it's going to bleed and dissect into all of the different layers of the vessel wall. And that would be considered an emergency.
Okay.
So there's a couple of risk factors that we need to know about aneurysms. So one, the main one would be if you have high blood pressure, that will need to be managed. A couple other risk factors would be if you're male, if you're of advancing age, so 65 plus, if you're a smoker, for females, if you're pregnant, if you have any congenital defects of the aortic valve or coarctation of the aorta. There are 2 main areas where the aneurysms can be located. They can be located in different parts of the body, obviously, but there are 2 main areas that we're going to talk about, which is thoracic, so in the chest area, and then we're going to talk about abdominal, which is going to be in the stomach. So with a thoracic aortic aneurysm, it's going to be up here by the heart in the chest. And with both of these aneurysms, you can be asymptomatic or not show any symptoms, but if you do show symptoms, you're going to have some upper neck or back or substernal pain. You're going to feel some pain in your ribs. You're going to have shortness of breath. When you breathe in, it might be a very high-pitched sound when you breathe in, which means that you're having a hard time breathing, and you could maybe be hoarse. To diagnose a thoracic aortic aneurysm, we are going to do either a chest x-ray, and you can actually see it, or you can do what's called a TEE, a transesophageal endoscopy, where they sedate you, and then they're going to put a scope down your throat to get a better view, and they can find a thoracic aneurysm that way. And then the second aneurysm is called an aortic aneurysm, which is found in the stomach. And again, you cannot have any symptoms, but if you do, you're going to have some pretty good pain in the abdomen, in the kind of the lower back by your kidneys, and just your back in general. And a key thing to know about an abdominal aortic aneurysm is that you're going to have a pulsation in the upper abdomen, slightly to the left of the midline. So kind of right up in here, you'll actually be able to see a pulse.
Okay.
And if you do see it pulse, do not push on it or anything like that, because it could rupture. So let's see here. Diagnostics for an abdominal aneurysm would be an x-ray, and the aneurysm is going to kind of have an eggshell appearance. It's going to kind of appear rounded like a little egg. You can do a CT scan or an MRI scan to assess the size and location. You can also do an ultrasound. You can usually do this for men ages 65 to 75 who have smoked, because they're at higher risk. And a lot of times this is just found on a routine physical exam. So one big complication that you can have with an aneurysm, especially in the area of the aorta, is an aortic dissection, which is a life-threatening emergency. It's caused by a tear in one of the layers of the aorta, and you just start bleeding out. The aorta is very important because it is the main vessel that pushes blood to the rest of the body. So if it's not treated immediately, you will not make it. You'll die. So it's an emergency. So with the aortic dissection, you're going to be doing surgery. You're going to be on a lot of different hypertensive medications to keep your blood pressure as low as they can while they're trying to repair it, so not as much blood is trying to push to the rest of the body. And it's a pretty big deal. So for us, so there's differences of treatment and monitoring for small and large aneurysms. So if it's a small aneurysm and it's less than about 5 centimeters, we're just going to monitor for the growth. We're going to schedule routine CAT scans every 3 to 6 months to see if it's growing, things like that. And we need to maintain the blood pressure, because it'd be more likely to rupture if your blood pressure is high. If it's a large aneurysm and it's more than 5 centimeters, we're going to do surgery immediately, whether that's a clip or some sort of graft, where we can kind of graft over the aneurysm and cut off blood flow so it doesn't keep growing and it won't pose a threat to the body system anymore. As far as surgery, if you are going to have surgery, before the surgery, we are going to teach what's going to happen. We're going to reduce fears of anxiety and fear, anything like that. And we're going to give medications to control blood pressure. And then after surgery, we're going to monitor the graft or the clip, whatever the surgery was. We're going to watch for bleeding. We're going to make sure that their intake and output is correct. And then we're going to just keep following labs and make sure that they're not bleeding. And a couple of nursing diagnoses that we would take seriously for aneurysms would be risk for ineffective tissue perfusion, because if you have an aneurysm and say it's dissecting, your tissues and your organs are not getting the proper blood that it needs. Risk for injury. You can have injury if you have an abdominal aneurysm and say you do something and it can rupture. That'd be risk for injury. And then anxiety. If you have a small aneurysm, the patient can be very anxious knowing that they have this, and they might think it's kind of a ticking time bomb, and that's why we need to really watch out and monitor while we can. So, looking back at our objectives, can you tell me What causes aneurysms, or kind of the pathophysiology?
Just a thinning, of the wall. Like I said, like a garden hose, it's kind of a weakening, and it can cause a rupture.
Perfect. And then diagnostics for aneurysms. How do we find them?
Either through an X-ray, like a chest X-ray, or do a scope to look at it internally that way.
And then what are some different treatment options with the different sizes of aneurysms?
Well, I think you would say 5 millimeter or 5 centimeters. If it's smaller than 5, you just kind of observe it every 3 to 6 months, and then if it's larger than that, you need to probably do surgery right away because it could rupture any time.
Perfect. All right, that's aneurysms.